all love the spring weather, but not the seasonal allergies that come with it. Joining me this morning with some tips and tricks this allergy season, Dr. Lauren Murrill from the Ear, Nose, and Throat Consultants. Welcome to the show.
Good morning.
A lot of people, of course, a lot of people are looking forward to this one because they're experiencing those seasonal allergies as we transition into new seasons. Why is it that spring and summer are referred to as allergy season?
So spring and summer tend to really be the start of the pollen allergy season. So trees start pollinating as we're seeing in the spring, grasses in the summer, and so those people who suffer from the pollen allergies really start to have symptoms this time of year.
Yeah, and those symptoms, they're similar to that of a common cold. How do you know that it's much more and that you actually have allergies?
So you are right, they're very similar symptoms: nasal congestion, nasal drainage, cough, throat clearing, sneezing, itching. The difference with allergies is that usually they're going to last a little bit longer than a common cold would, so weeks, and often you'll see them at the same time every year.
And there are actual tests that you can take outside of monitoring, you know, how long it's lasting, but tell us about the tests that people can take to see if they have allergies.
Yep, so there's two ways to detect allergies and to really determine what you're allergic to and how severely. One is a blood draw, which is not as sensitive to the allergies we're testing. The other is an allergy test, which is pokes on the back and pokes on the arms that tell us what you're allergic to and how significantly.
Now, once you know that you have allergies and you know they may flare up during allergy season, is there any way to get ahead of it to prepare for it so your symptoms aren't as bad?
Definitely. So there's really three ways to treat allergies. One is avoid the things you're allergic to, which is hard for people with environmental allergies. Two is medications, so things like nasal sprays, over-the-counter allergy pills, nasal rinses. Those, if you know that spring classically for you is significant, starting them like a few weeks or even a month before the spring season starts can be very helpful. And then for patients who have severe allergies, something like immunotherapy, which is allergy shots or allergy drops, that's given to you year-round regardless of your allergy season and can be very effective.
All right, and you also brought this in. Tell us about this remedy here.
So these are allergy drops, or this is the bottle that we use for those. The concept of immunotherapy is giving your body the things that you're allergic to in small doses over time to try to be a little bit more curative. And there's two ways to do that. One, a shot in the arm, which patients are usually familiar with. But then you can also do allergy drops, which is the same concept, but you're using a liquid under the tongue, and this is how you do it. And that's at home, and it's daily, so you don't need to come into the office for shots.
Okay, is one method more effective than the other?
Very slightly. They're both in like the 90+ percentile for effectiveness. So my feeling is if you need to do something, they're both better than doing nothing. Very small difference in effectiveness.
And as far as, you know, the longevity of it helping manage your symptoms, does that vary depending on what you use?
This is more curative. So after you do immunotherapy, which is a commitment, it can be 3 to 7 years of treatment. You're getting like a decade plus of relief. So patients on medications, you're really just doing symptom relief. So as allergy patients know, you stop doing your medications, the symptoms come back, and that's kind of an indefinite treatment. This is a little bit more, you got to commit to it, but then you get longer relief.
Yeah, so we have the shots, the nasal sprays, the drops. What are some things that people can do at home to kind of mend their allergies a bit?
Sure. So before coming to see us, if you think you might be suffering from allergies, getting on just kind of a regular, what I like is a nasal regimen. So something like a nasal rinse. People think about like the neti pot. There's one called a sinus rinse, the navage. Think about that kind of like a little shower for your nose.
What does that do?
So it's actually rinsing out your nose with just salt water, like saline. That's going to get out any mucus that's building up, but it's also going to rinse out dust and pollen and all these things that your nose is reacting to.
Interesting.
So that can be really effective, especially like after cutting the grass. Clean out your nose, make sure that's not sitting in there. And then some of the over-the-counter nasal sprays can be really effective as a first start.
Interesting. All right, I learned a lot today, and I don't even have allergies. Charlie, this was for you. Hopefully it helps, and hopefully it helps you all at home as well. Thank you so much for all those helpful tips.